Hello, everybody. So we're right at the end of the semester, and I wanted to just go over a few things that we've covered over the last 15 chapters of material that you can use as a study session or a study guide for your final exam. Now, there will not be a PowerPoint, just only this lecture for you to study with. Make sure to know the abbreviations for terms that are provided in the lecture. On some of the slides, you'll see that. With some questions on the exam, you may have to select from an abbreviation instead of a term. Follow along with your textbook. I have the page numbers listed on each of the slides where you can follow along in your textbook, and you want to focus in on those bold red text. The page numbers for the material I'll be covering are on the slide, so we are going to start out with Module 1, the core concepts of diseases. On page 2, uh, we've learned about some terms associated with diseases. First of all, pathology is the study of diseases. Pathogen is an organism that causes a disease to its host. Idiopathic is a disease occurring spontaneously with an unknown cause. On page 25 and 26, our text talks about the difference between signs and symptoms. Signs are objective measures, such as height and weight that can be obtained, and symptoms is an observable state or behavior that is subjective. Symptoms, it all depends on the patient's feelings. On page 28, 29, we're going to discuss the importance of diagnosing a patient correctly with the use of labs and testing. Diagnostic tests can include numerous things. This is some of the examples, like a chest x-ray, which examines the thoracic cavity. We have an x-ray utilized for bone breaks and defects in the body. We have a CAT scan. We have an MRI. As an example of that would be to view detailed images of ligaments and tendons. We have electrocardiogram, which records electrical impulses produced by special cells in the heart. So, and again, those are just a few examples of some of the tests that you might receive or a patient might receive. Now, in chapter 2, the mechanism of a disease goes over the sources of diseases. On page 37, our text talks about congenital diseases, which is a hereditary disease, which is passed down from your parents. There are 3 types, which is chromosomal, abnormality of a whole or partial chromosome. You have a single gene, which is more likely to be a recessive disorder, and then a multifactorial disorder derived from many abnormal genes. Uh, then on page 39 and 40, we learned about some of the ways to provide nutrition supplements if the patient has malnutrition. Um, so the healthcare workers may go through a parenteral route where nutrition is given by an injection, TPN, where nutrition is received through a vein. A procedure is performed to insert a feeding tube. Sometimes they do. The procedure is called a percutaneous endoscopic gastrostomy procedure. They also use a PEG feeding tube that is inserted into the stomach wall. And then a short-term solution they can use is a feeding tube that's going through the nasal cavity using an NG tube. On page 43 and 44, we see immunity being discussed. Immunity is our body's way to protect itself from illnesses. Autoimmunity is a situation where the immune system fights against its own tissues and cells. An example is Hashimoto's thyroidism. On page 50 of our text, it talks about the infections and some terms we should be mindful of. The first term is normal flora, which is bacteria that are always present on our bodies or in person and are needed for normal body function. Next is opportunistic organisms, that is bacteria that invade other regions of the body when the immune system is suppressed. This can be caused by drugs wiping out the normal flora, opportunistic organisms take advantage of the fact when we are sick and have that weakened immune system, and at that point, all bacteria has an open door to come in. Some causes of infections can be bacteria, viruses, fungi, protozoa, um, and then we have those helminths, are those nasty tapeworms, which are found in both animals and humans, and then we have pinworms and hookworms. Module 3 teaches us about core concepts of pharmacology, I'm sorry. On page 70, our text covers the 1938 Federal Food, Drug, and Cosmetic Act and amendments of 1951 and 52 stated that all new drugs in the U.S. be deemed safe by FDA before they are marketed to the public. This included prescription and over-the-counter medications. The law also stated that warning labels were to be placed on medications. An example of a warning label that is regulated might say this medication may cause drowsiness. Now on page 77, we have some terms our text goes over that you should be familiar with. Pharmacology, which is the study of drugs. Pharmacotherapy, which is the application or use of medications to treat diseases. Therapeutic level, which is a desired level needed to treat diseases. Toxicology, the study of pharmacology, actions on the body with poisons and their antidotes. And then pharmacogenetics, which is the genetic differences that can cause a drug to affect us in different ways, whether therapeutic or adversely. On page 80, our text refers to trade names and generic drugs. Now, when drugs are submitted to the FDA for approval, they must have a name so they can be tracked. The generic names are provided by the United States Adopted Names Council. The name is given to the drug must be non-proprietary and not owned by any company. A trade name is also as brand names are proprietary and are developed and owned by pharmaceutical companies to market their creations to the public. A trade name often has hidden meanings to what the medication does. And some examples of trade name drugs are Ambien, Plan B, and Prevacid. Physicians have traditionally used paperback forms of the physician's desk reference, and those of you that have been in healthcare have probably seen this in years past. And some physicians keep this around for specific medication information. Drug manufacturers are required to provide this information to the FDA so that physicians can have a reference to medications. You know, of course, now times have changed and now physicians can get all this information from the internet, which is a lot faster and more efficient. Now, Module 4 talks about administering drugs in dosage forms. On page 106, we have some terms that you should master. The term enteral route means through the GI tract. The enteral routes includes the oral route or PO, nasogastric tube or NG, and rectally or PR. On page 108, we learn about some of the oral drug forms, lozenges held in the mouth until it dissolves, suspension, which is a liquid form that has to be shaken, emulsion, a drug preparation that is a liquid containing fats and oils in the water, elixir, a liquid drug mixed with an alcohol base, and then a solution, which is a liquid with a drug completely dissolved. And then you have the syrup, which is sweetened, colorful liquid drug. Medication given to patients by an injection is dispensed by ampules, vials, or pre-filled syringes. Ampules are a glass bottle fused closed and must be broken to open, and vials are a glass container with a lid with a rubber stopper that a needle can pass through the stopper to be filled. And then you also have pre-filled syringes. On page 132 and 33, we see some commonly used abbreviations that appear in medical records. Once you're trained as an HIM professional, you'll be reviewing medical records daily, so it's imperative that you are familiar with this common material. All of these abbreviations will be seen throughout the medical record, especially on the medication administration records, for example. You may see BID, which means twice daily, TID, which means 3 times daily, QID, which means 4 times daily, and PRN, which means as needed. Module 5 covers cancer and anti-neoplastic pharmacology. Now this starts off on, we're going to start off on page 141 of our text. It goes over the cell cycle, starting out with interphase, which is termed the cell cycle starts with functioning and stockpiling all the stuff that is needed for the cells to divide. We go next to the mitotic phase, which is actual cell division, and the final stage is the division of the cytoplasm, which is called cytokinesis. And we do all of that for the cell to die, which is called apoptosis. Isn't that something? On page 143, we're going to first discuss the difference between benign and malignant tumors. When you have an uncontrolled growth, it will lead to a lump or a tumor. Benign tumors are non-cancerous and do not spread. An example of a benign fatty tumor is a lipoma. Tumors are further classified by their site of origin. Some days I just can't talk. Most days I just can't talk. On page 145, our text continues with cancer metastasis. Carcinoma in situ occurs when the cancer hasn't broken through the basement membrane and invades other tissues or sites. Tissue necrosis occurs when malignant tumor blocks blood flow, which causes the death of a healthy tissue. Cancer cells usually spread through the lymphatic system, where the lymph nodes try to filter out the abnormal cells. Module 6, the pathopharmacology of the musculoskeletal system, starts on page 163. We're going to start off in Module 6 with the 3 types of muscles found in the human body: the skeletal, the cardiac, and the smooth muscles. The skeletal muscles are voluntary muscles that attaches to the bones. The cardiac muscles are involuntary muscle that is found in the walls of the heart, and smooth muscles are involuntary muscles found within the lining of hollow organs. On page 166, it goes over some terminology related to muscles and their functions, starting with myofibrils, which are tiny strands of muscle fiber, endomysium, which is sheaths of connective tissue, sarcomeres is protein threads of small contractile units of striated muscle. We have myosin, actin, and Z-lines. On page 167, it continues with agonist muscle or primary mover. This main muscle causes movement, and an example of this is a bicep curl, which produces flexion at the elbow. Antagonist muscles returns muscle contraction back to its original resting position, and synergistic muscles that move to assist the primary muscles movement. On page 192, it starts off with the common joint diseases, which include arthritis, osteoarthritis, rheumatoid arthritis, systemic lupus, gout, which is a buildup of uric acid in the blood causing pin-like crystals to develop, and then TMJ or TMD, an inflammation of the joints in the jaw. Module 7 is the integumentary system. On page 209, it talks about the layers of the epidermis, which is the layer of the skin that you can see, including the dermis, which is considered true skin, which lies below the epidermis. And then you have the stratum corneum, the stratum basal, and keratin. Some terms to be familiar with about the skin color include melanocytes, melanin, freckles, keratin, jaundice. And keratin is skin pigment that gives a normal yellowish hue to the skin. And albinism and cyanosis and acrocyanosis. On page 216, we have some topical skin medications, antipruritics, corticosteroids, emollients, soothes irritation and protects skin damage from minor burns, and then the several other that are on the slide. On page 221, we talk about the antifungal integumentary disease. We talk about tinea cruis, which is the jock itch. We have ringworms, candidiasis, and a lot of these are, if they're left untreated, they can cause bacterial infections, especially those funguses, those nasty funguses. Many viral diseases are acute, others may remain dormant in the body. We have forms of herpes that include herpes simplex, herpes varicella, which is a viral infection that can cause chickenpox. We have herpes zoster and shingles. And you know, you see shingles in commercials on TV, and talking about the it being a very painful skin lesions that follow the course of the spinal nerve. Module 8 starts with gastrointestinal diseases and medications. On page 346, it talks about the pharynx, which is a hollow muscle tube for passage of food, water, and air. And the parts of the pharynx include the nasopharynx, aeropharynx, and the laryngopharynx. On page 245 and 46, it covers the esophagus. Food moves through the esophagus by a wave-like motion called peristalsis. As food moves down the esophagus, it passes through the pharyngoesophageal sphincter and then to the cardiac sphincter, which is a circular or ring-shaped muscle leading to the stomach. On page 253, it has some common diseases of pharyngitis. It's caused either by bacterial or viral infections. And then we have we have GERD, which is the reflux or movement of acid from the stomach to the esophagus. And GERD is treated with a proton pump inhibitors, H2 blockers, and antacids. And those types of treatment, they inhibit the release of acid. On page 256 and 57, our text talks about hernias and esophageal varices. Hiatal hernia. This is where the upper part of the stomach bulges through the diaphragm. This disease can be treated with antacids. Esophageal varices are treated with beta blockers or sclerosing agent. Boy, they got some names in this book, don't they? On page 270 to 271, it covers the intestinal obstruction. The causes of intestinal obstruction include diverticulitis, which is the small bulging pouches in the colon wall. And then they have Susception, which is part of the intestine, folds into itself. On page 275 and 276, it talks about we continue with diverticulosis and diverticulitis, and you want to know the difference between those two. And they are both diseases of the colon, and treatment can include antibiotics and analgesics, aspirins. How about that? Which that is an aspirin. Then you have colon polyps and colon cancer. Now, on page 285 and 286, it talks about the pancreas, which produces a variety of enzymes that break down food substances. This organ produces a variety of enzymes that break down food substances, along with secretions of glucogen from the alpha cells of the islets of Langerhans for adequate plasma glucose concentrations. In other words, it helps to control blood sugar levels by making insulin. Then you have pancreatitis, which is caused when bile enzymes are inflamed. Module 9 starts on page 287, talking about the endocrine system. And there are two forms of diabetes. You have diabetes mellitus and diabetes insipidus. Diabetes mellitus is the term that you hear more so than you would insipidus. But diabetes mellitus involves the insulin and blood sugar, and diabetes insipidus involves the kidneys not being able to retain fluid. There's not enough antidiuretic hormone that is secreted. Now, there's two forms of diabetes mellitus that you'll hear about, which is type 1 diabetes and type 2 diabetes. Type 1 diabetes is often called juvenile diabetes because patients are born with this condition or they develop it before the age of 30. And type 1 diabetes is caused by the body not being able to produce enough insulin. Now, type 2 diabetes is a little bit different. So this is a chronic condition that affects the way the body processes blood sugar. It's not necessarily that it's because the body is not being able to produce insulin, but it's the way the body processes the blood sugar. And it's caused by poor diet, a lot of time obesity, and lack of exercise. I mean, it's a curable condition. The thyroid disorders, which is on page 304, the thyroid gland's function maintains the body's metabolism. Body temperature assists with digesting food. On page 306, it talks about hypothyroidism, which is caused by an underactive thyroid, which decreases the body's normal production of T4. Your common symptoms of this is increased weight gain, fatigue, weakness, muscle weakness, and you have a sensitivity to cold temperatures. And then you have myxedema. Myxedema is an advanced form of hypothyroidism. On page 308, our text talks about uncommon diseases. An uncommon disease, which is Addison's disease, which is caused by the body having too little cortisol. Cortisol is produced from the adrenal glands, and it's a disease that can be life-threatening. It can occur in patients of any age group and does not favor to any particular gender. Module 10, it starts on page 312, talks about the urinary system. We have two common tests that measure the level of nitrogenous waste in the blood. We have a creatinine clearance test, which is used to check how the glomerulus filter out creatinine. and we have a bun test. And if you've ever had blood tests, a lot of times they'll check these. It's just common tests that they usually do. A bun test is a blood test that used to check the function of the kidney, and it measures the level of urea nitrogen in the blood. Uremia occurs when the toxins are found in the blood. That term usually means that there's urine in the blood. It does mean that there's urine in the blood. I'm sorry, not usually. Now, some of the antimicrobials to use UTIs are sulfonamides, I believe is how you say that, is an antimicrobial agent, and it's indicated for gram-negative bacteria and includes Bactrim, Septra, and then some other drugs there that folks take. And then you have some antiseptics such as Hyprex that can be used to treat UTIs also. Urethritis is an inflammation of the urethra. If you remember about your medical terminology, anything ending in itis always means inflammation. So urethritis may be the cause of STDs such as chlamydia, gonorrhea, or herpes simplex virus. Chlamydia is known as a silent STD, and it's treated with fibromycin, doxycycline. I've heard, you hear of that, and gonorrhea is treated with Suprex, and then herpes simplex virus, which is herpes, is known as herpes, is treated with Zovirax, I believe is how you say that. And I do apologize about that I can't say some of these words. I do apologize. On page 333, we're going to discuss polycystic kidney disease. This disease affects both your kidneys, which is an inherited disease that slowly destroys the kidneys, and kidney function is greatly reduced and hypertension develops. It can be treated using ACE inhibitors, antibiotics, and Tylenol. Chronic renal failure has 5 stages, and as this disease progresses, the symptoms usually get worse. You have in those 5 stages, like the stage 1, stage 1 and 2, the patients may not have any symptoms at all. Now, when you get to stage 3, they start having, symptoms that usually have changes in the urine output. They have kidney pain, muscle cramping, edema, weight loss, and fatigue. Stage 4, the urine becomes darker and patients start losing weight, high blood pressure, confusion, and kidney pain. Stage 5, kidneys are not functioning and producing urine. On page 337, it talks about the hemodialysis that can be used when the patient has chronic renal failure. When a direct catheter line is placed into the bloodstream, a machine is set up to filter the blood as the kidneys would normally do. This will maintain proper balance of electrolytes. Module 11, we're going to discuss the respiratory system diseases. On page 346, it talks about epiglottis, the leaf-like fibrocartilage that when you swallow closes over the opening of the trachea, thus directing food or liquid down the esophagus to prevent aspiration. Now, our text calls this part of our body a traffic controller that acts as a lid or a door, allowing only air to travel down your lungs and food and water to travel down your stomach. On page 339, discusses on the clinical connection Oh, okay. It discusses, we want to focus in on that clinical connections 11.2 on page 349, where they discuss upper airway infections in children. Pediatric infections may be caused by either bacteria or viruses. Two conditions that are pointed out are croup, which is characterized as a barking cough, and pertussis, not commonly known as whooping cough. I mean, we always used to say, when my kids were little, they always had whooping cough. They started to have that barking cough, even though they didn't have that croup. Pertussis has been recently seen, has had a comeback in the U.S., and providers have recommended boosters for parents and immunization vaccines for children for prevention. On page 352, it talks about laryngitis, which is what I'm about to have because I have a sore throat, maybe acute or chronic, maybe viral or bacterial. Symptoms include dysphonia, which is difficulty speaking, dysphagia, which is difficulty swallowing, fever, and pain. On page 6, or on page 349 and 350, you have acute rhinitis, and some of the medications that they use to treat rhinitis, acute rhinitis, and allergic rhinitis, and some of the medications there that they use to treat that. And then you have prophylactic treatment for acute allergic rhinitis, and prophylactic treatment prevents allergic rhinitis. Module 12, we're going to cover the cardiovascular system. On page 386, you'll start out this chapter off with what is in blood, which consists of plasma and blood cells. And plasma contains proteins, salts, nutrients, water, oxygen, carbon dioxide, and molecules. They have clotting abilities, plasma does. And globulin is used to create antibodies to prevent infections. Albumin plays an important role in fluid regulations, and low albumin can cause edema, which edema is swelling caused by fluids trapped in the body tissues. Usually you have edema in your lower legs. Blood cells consist of RBC, which is red blood cells, and white blood cells, which is WBC. And then you have platelets, which aid in the clotting of blood. At the bottom of page 389 is a figure that depicts the four main blood groups that we're going to cover. We have type A, type B, type O, which has blood that does not have any A or B antigens in the red blood cells, but both A and B antibodies in the plasma. This blood type is commonly known as a universal donor, and then type A and B has both A and B self-antigens, but no A and B antibodies. And a person can receive blood from anyone. This blood type is commonly known as a universal recipient. Now, a common blood test is checking cholesterol levels, where they check the LDLs, HDLs, and triglycerides to determine if a patient is at risk of developing plaque. LDL is commonly known as bad cholesterol, which is responsible for the development of plaque deposits on the walls of blood vessels. This buildup eventually could cause high blood pressure or even a heart attack. Now, hypertension is treated with various medications such as nitroglycerin, statins, bile sequestrants, nicotinic acid, and beta blockers. Cor pulmonate, which is a heart condition caused by bad lungs. Anytime you see that pulmon, you know that that's some kind of condition with the lungs. Again, it's all goes back to your medical terminology. The bad lungs cause the right side of the heart to fail. Medications, you could have blood thinners for this condition. You could take diuretics, vasodilators, inotropic agents like digoxin. Now, Module 13, we go over the nervous system. On page 425 and 26, it discusses the sensory system and motor system. The sensory system, the input portion of the nervous system that receives information about the immediate environment. The nervous system relies on the sensory system to activate the motor system, and the motor system consists of the somatic nervous system and the autonomic nervous system. Now, there are two forms of nervous tissues, the neuroglia and the neurons. Glial cells line cavities and support and protect structures. Schwann cells make up lipid insulations called myelin that lines neurons. The human brain consists of your frontal lobes, your parietal lobes, your occipital lobes, and your temporal lobes. Your temporal lobes are for hearing, taste, language, comprehension, and integration of emotions, and insula. Your cerebellum, which is also called the little brain, helps with sensory and motor coordination and balance. And then you have your brainstem, which contains the medulla oblongata, pons, and midbrain. Diagnosis of encephalitis is often done by lumbar puncture, where fluid is obtained for where they analyze the fluid. And when they analyze the fluid, a specialist can identify the causative organism in the CSF fluid and obtain the proper medication for treatment. On page 442 to 444, we talk about the vascular disorders of the nervous system. Some examples of those vascular disorders are CVAs and TIAs, which is cerebrovascular accident, which is commonly called a stroke. You have anticoagulants that are used to treat CVAs. And then we have TIAs, which is a sudden mild mini strokes. Now, Module 14 is the eyes and the ears. Some anatomy of the eyes on page 470. We need to focus in on the parts of the retina. The rods, which are the active in dim light and do not perceive color, and cones, which work best in bright light and can perceive color. Types of refractive areas: myopia, which causes nearsightedness. We have hyperopia, which is farsightedness, and then we have presbyopia, which is caused by old age, and then we have astigmatism, which is blurry vision. And all of this can be diagnosed with a comprehensive eye exam. Visual acuity is diagnosed with they call it a Snellen chart. I'm sure you've seen one where they have the big A at the top. That's a Snellen chart. Refractive errors is on page 476. So you have surgical procedures used for refractive errors. You have the RK, is to correct myopia by making radial incisions into the cornea. And then you have ALK, which is microkeratome, is used to separate a thin layer of the cornea for a refractive area. And then you have the LASIK surgery, the ICL surgery, and then the CK surgery. On page 477 to 478, we have the anti-inflammatory agents, the corticosteroids, which is anti-inflammatory agent that treats acute allergic reaction of the eyes. And then you have the types of corticosteroids include those different types of medication listed on the screen. We have on page 481, we have conjunctivitis, which is pink eye that can be caused by bacteria, viruses, or it can even be caused by stressful environmental conditions. And then your treatment is listed on the screen, and it could consist of just simple as a warm compress, or you may have to go to the doctor and get an antibiotic depending on the severity of it. Nystagmus can be caused by a congenital neurological defect or the result of a stroke or trauma later in life, and it can be treated with a corrective lens. Module 15 is a reproductive system. Like was stated earlier, a lot of these diseases you can tell what is going on because of medical terminology. For example, metrorrhagia is excessive bleeding or abnormal bleeding between periods, and this is caused by a hormone imbalance. And the treatment includes a D and C. On page 517, it talks about the ovarian cyst, which is a benign fluid-filled sacs found on or near an ovary. And remember, benign is non-cancerous. And some of your symptoms may include pain in the lower back and pelvic region. And then your treatments is listed on the screen. On page 531 to 532, it talks about the male anatomy. And the one that we want to focus in on is a vas deferens, which is ligated and transected in the vasectomy process, which is a permanent solution that entails either cutting or clamping off the vas deferens so sperm cannot mix with seminal fluids. On page 536, we have prostate cancer. This is one of your most common cancers, which affects the prostate gland in males. The prostate gland produces seminal fluid that transports sperm. This type of cancer can be diagnosed with a digital rectal exam and a prostate-specific antigen blood test. Now, this concludes our slides, but I just want to go over what is on the final exam, some final exam information. It consists of 75 questions, which are all multiple choice questions with the exception of just one fill in the blank, thank goodness, right? The exam will shut off in 75 minutes and automatically submit if you're not finished. So make sure to give yourself ample time because this will be longer than your usual exam that we have taken in this course. So of course, if you have any questions, make sure you just feel free to contact me. So good luck and have a great day.